A lot of patients ask me, what does the day of surgery look like? Well, generally speaking, you're going to arrive about an hour and a half before surgery itself actually starts. You'll meet our intake team who will help get you in a position and get you checked in. We'll then go to the pre-operative holding area, and that's where you'll kind of get set up for the surgery. That'll include things like getting an IV started for you, making sure all your medications and medical history is up to date, and meeting the anesthesiologist and the anesthetist is going to be taking care of you during surgery. A lot of times we'll end up doing what's called a nerve block. A nerve block is meant to decrease pain around the area of surgery. On the day of surgery, of course, before anything is done, you'll talk to me again and have any questions you have answered at that time. Remember, that is your time to ask me anything that's on your mind. And we have nothing but time to help you do that first. So it's no rush. Take your time and bring your list of questions if you have any. Once we actually get ready to start surgery, we'll have you go back into the operating room. Now, a common misconception is that surgery does not start as soon as you go back into the operating room. There's at least 30 to 45 minutes of setup and equipment that needs to be done before we actually start the surgery. Additionally, the anesthesiologist has to put you to sleep, so this can make it feel like surgery is taking longer. But in fact, the whole time you're not actually under surgery. For a typical hip arthroscopy, the actual time that I'm performing surgery is about an hour and a half. However, the time under anesthesia can be 2 to 2.5 hours depending on other factors, which can include, once again, setting you up before a surgery, getting you into the correct position, then helping you to wake up after surgery and get you back to the post-operative holding area. Once you're in the post-operative holding area, or you can call it the PACU, the nurses will help you to wake up, make sure you're safe to go home. They may get you something to eat to make sure your stomach is settled. And once you're awake and ready to go, we'll have your family members called and help you to transport outside of our facility.